Good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolphin Simons Jr. Family Studio. Welcome back to Open Mics with Dr. Stites. Today, we're continuing our month of breast cancer stories with a look at what happens after a mastectomy. Many women will want to rebuild their breasts, but there are so many options for how that reconstruction happens. Janine Kiesling, got that right, didn't I? I did. Excellent. All right, introduces us to one survivor who has been on quite the journey so far.
Wendy Murphy didn't think she'd be around to see her daughters graduate or walk down the aisle because she was told her cancer was too advanced. Learning that diagnosis was wrong was one of the best days of her life.
There is a good old rumor out there that if you have pain, it's not breast cancer, and that's a lie. I can say that for sure.
Wendy Murphy blamed pain she was having back in 2016 on scar tissue from breast implants. But during a trip out of town to watch her daughter play softball, the pain was so severe, she made an appointment to get checked out the second she got back in town. Soon after, Wendy was diagnosed with breast cancer, and her prognosis wasn't good.
He told me it was like the worst kind of breast cancer you can get, the one that, you don't come back from.
Wendy decided to seek a second opinion, and friends directed her to the University of Kansas Cancer Center. That's when Wendy learned her cancer diagnosis was wrong. The type of cancer she had was very treatable, and in just a few days, Wendy started chemotherapy.
I knew the minute that I met my team that I was going to be okay. Every single person that I interacted with at KU made me feel okay every single time. There was just a sense of knowing I was in the right place.
Wendy had a big birthday during chemo. She turned 50. Another milestone followed at Belton High, where she worked, when the school honored her as the Pink Out celebrity at a football game.
So I went in front of everyone bald-headed. There is a picture, and it's a very powerful picture from that coin toss that is pretty special.
It was a big moment for Wendy, who has always been extremely self-conscious. Her self-awareness was part of the reason she decided early on in her cancer treatment to plan for reconstructive surgery.
This is an emotional part for me. I struggled my whole life with body image. It was important that I have something.
Plastic surgeon Dr. Julie Holding was determined to give Wendy what she wanted, a natural breast using tissue from her own body. There were challenges. Dr. Holding patiently guided Wendy through each step. 10 outpatient surgeries over 5 years. As Wendy's breasts improved with each surgery, Wendy says her perspective and priorities did too.
The second thing that was important was that I was healthy and that I took care of myself. The physical beauty part just happens to be a plus. What was most important to me was to be on this earth for my kids.
That's really powerful. Wendy Murphy joins me here on the desk. Wendy, thanks for being here with us this morning, and thanks so much for sharing your story.
Thank you.
I also want to thank her plastic surgeon. Dr. Julie Holding has been feeling a little under the weather, but she's going to join us from home. Dr. Holding, how are you feeling?
Better than I sound.
That's a good voice. I like that. We're going to have to ask you a lot of questions to see how that voice goes today, huh? All right. Wendy used to work at Belton High School, and you shared a video of the moment you revealed to some students that you had cancer. Let's take a listen.
I think there's only one person in this entire room who's ever seen me like this, poor Michael. But this is cancer. I don't look normally like I have cancer. I don't act like I have cancer most days. That's by choice.
You were speaking to the football team, right?
Yes.
About excuses. What did you tell them when you took that wig off? What did you tell them about excuses?
When the football coach asked me to speak to them, he was really struggling with kids who just, were making up excuses for why they weren't doing things the way they should be. So what resonated was talking about excuses and reasons. And you can make excuses for everything. And there are a lot of people who actually have reasons why they can't do things or they are unable to. And I was a walking billboard for that. I could have used my treatment as an excuse to not go to work for the whole entire year, or not live life, or get out of doing the dishes, whatever it was. It's just, you can't let that hold you back. And excuses are kind of lame, most of the time. So.
My wife tells me that a lot. I think you're a little late with that one, Stites.
Yeah.
All right, so at that point, was breast reconstruction even on your mind?
I had met with Dr. Holding. I knew I was in good hands, but I was in the middle of chemotherapy at that time. So just getting through that was my main goal. And being there for the kids at the high school, I was the first person you saw when you walked in the high school, and being there for my kids and letting them know I was okay, I could get up and go. Mom was okay, let's get things done. And that's just what we continued to do. So I knew it was there. I had met with Dr. Holding. I knew I was in good hands, but at that point, it was not much of a thought.
So breast reconstruction is really a one and done surgery, right? It's a process. But Wendy, in your case, it was a really long process, 10 surgeries over 5 years. Now, how did you keep your head up through all that?
I tend to have a kind of get it done mentality. So I hated the idea of being sick. So as soon as I had a plan, I was ready to go. When Dr. Holding and I talked about what my surgeries were going to look like, pretty much I was just impatient to get to the next one and get it done. So
did you feel your body, did you feel like it was improving after each procedure?
Absolutely.
Yeah.
Every single procedure was just a new step in the right direction every single time.
You seem like one of those people who can say, I got a goal, I'm going to go get it. But at some part, this had to be tough when you had to go through 5 years of that. What was the toughest part?
The toughest part was probably my impatience. We had to wait a certain amount of time, 3 months between the surgeries, in order to recover properly. And if I could have done it like once a month, I would have done it once a month. Yeah. So.
Or just done it all at once. That would have been awesome, right? But
yeah.
I guess
that one wasn't as fun, the first one. But the continual surgeries were not physically that difficult for me. It was more about just wanting to get it done and get to the next one.
You are so brave for sharing this story. Thank you. We're going to be back with you in just a moment, but I want to switch now and talk to Dr. Holding. Now, you start the breast reconstruction process immediately after a mastectomy. The surgical oncologist steps away from the table, and you step up. What happens during that initial surgery?
Well, we have a conversation with the patient, and it's really based on their guidance. So I tell them, you can either start at the time of the mastectomy and you can do, implants, a tissue expander or spacer, or you could do nothing and wait. But, in her case, we started with the tissue expander.
Okay, so now we have a video of something called the acellular dermal matrix, which you're going to help us understand and why that's important. What exactly is an acellular dermal matrix in ADM?
To be as simple as possible, it's really cadaver skin, the dermis, so that's the connective tissue, the strength layer of the skin, but it doesn't have any cells, so it's kind of like a scaffold, and we use it to help reconstruct the soft tissues to give the reconstruction more support, and the body will actually, incorporate it or use it as its own tissue, and it'll get its own blood flow.
So because it's acellular, it doesn't reject the tissue, it actually uses it. That's pretty cool, huh?
Yeah.
Now, we heard in the video, Wendy wanted to use natural tissues as opposed to implants. Tell us what that means. Where do you take the tissue from? Is that why it took 5 years? There's so many questions here.
I know. Well, yeah, broadly, there's implants and there's your own tissue. And with your own tissue, there are limitless areas we can take it from depending on the patient. For her, we chose one of the most reliable and one of the best areas to take it from, which is her stomach, her abdomen. So similar to, say, a tummy tuck, and then we take the tissue of the lower abdomen, and rather than throw it away, we keep the blood flow to it and then take it off and then hook up those blood vessels to her chest blood vessels under a microscope. So she gets a little bit of body contouring at the same time.
All right, a little body contouring. But now somewhere in there, you've kind of talked about what is a graft and what's a flap. Help us understand that.
So a graft is something that doesn't have blood flow brought to the area. So it's placed on top of the tissues or in the tissues, hoping to get blood flow from that area. Now, a flap is a piece of tissue, whether it be skin, fat, fascia, muscle, whatever the case or whatever is needed for reconstruction, and it's brought to the area with blood flow. So whether that be it's rotated into place or a free flap, which is taken completely off of you. And I tell patients, if I held up their deep flap or their breast reconstruction flap, it would look like a little jellyfish because of the artery and vein hanging down.
So do you have to reconnect all those artery and veins?
Yep.
So it takes a while, I expect, to do all that, huh?
It is definitely technical, yes.
Yeah. Now, the video mentioned there were challenges in Wendy's case. Dr. Holding, what were some of those challenges?
Well, the deep flap, the abdominal flap, is actually a very reliable reconstruction, meaning it's successful many times. But of course, there are those times that it's not. And for her, one of the reasons why it wasn't was because she just didn't have enough blood flow on one side of her abdomen on its own. So when I made one flap and then I turned to the other flap, it just wasn't getting enough blood flow. It wasn't surviving on its own. So I knew that if where it was on the abdomen wasn't going to survive, it for sure wasn't going to survive on the chest.
Okay, now, this is amazing, but I've been looking forward to this next part of the program all morning long since I saw this script because there's a pretty cool word in here. Let's talk about a device with a pretty kind of funny, cool name. This is a video of your Nugalberry. Now, as I understand it, a Nugalberry, that's a pretty good name, Nugalberry is a breast enlargement pump. So, okay, Dr. Holding, you have to tell us what a Nugalberry really is and or what happened. What's going on with that?
Well, first of all, I don't get any money from this company. They're an English or British company, and they make all kinds of pumps for enlargement. So they're actually for breasts. But the idea for reconstruction is I've used them because as opposed to a tissue expander, which Wendy had one and it's inside and it's pushing on the skin and which thins the skin. This actually is on top of the skin, and it's cupping. Okay, so it sits on the skin and it suctions that skin up and tissue up, and what it does is it accordions it out, so it increases the space of the tissues, and it improves and stimulates new blood vessels to form, so that in that situation I can do grafting of fat as opposed to the flap, and I can put in more fat at once, and then more will take.
Okay, so what did you think about it when she first said, I got this device for you called a Nucleberry? Well, what was your thought about that?
Interesting name for sure. And then what they're well known for is for different body parts. So we joked quite a bit about that.
Now, this is a PG program, people.
But Dr. Holding knows I'm game for anything. So if it was going to help things along a little quicker, I was willing to do it.
Excellent. So, Dr. Holding, all kidding aside, patients use this at home, then come back to you for surgery, go home to use the Nucleberry some more, then come for more surgery. How many times do you have to go back and forth through that process?
It's step by step. I mean, fat grafting, what I do is I do liposuction, and I collect the fat in what I call a fat salad spinner, because there's a little basket. The fat goes in there, the water goes out, or the fluids go out. I put the fat in syringes, and then I have to build a breast one layer at a time. So it's quite a long process that way. But the nice thing is that they go home the same day, as opposed to when she had the flap surgery, she was in the hospital for 3 or 4 days. And there's only 2 weeks of restrictions after that. But it is a long process because it's step by step, and the patient kind of tells me when they're done.
So you can, with each process, essentially you're going to make things a little larger or a little different shape, and that's why it could take a longer time over a period of years to get that done. Is that right?
Correct.
Oh,
it's like building a wall. It's like building a wall one layer at a time and letting that kind of cure and harden for a while, and then starting over with the next layer.
And does the Nucleberry have to be applied after each layer of the wall?
So it's actually, I mean, it's something that I've been developing personally. It's something that's been shown to have improved blood flow, as stated, and compliance in the tissues. I suggest that they use it at least, 2 months before surgery. Immediately after surgery, I have them wait for a period of time, and then I have them use it again for another 2 to 3 months. The device is worn for at least about an hour a day, if possible. So, and that's sometimes challenging because it's uncomfortable, it's bulky. If they move around too much, it can pop off. But there are all different kinds of cupping devices out there, and I tell everybody, as long as they can use something and it works for them, then that's great.
That is, and I saw you shaking your head. Yes, you used it after. Yep, there's a big yes. I'm pretty sure I've seen that one.
The post appointment, she was get back on the Nucleberry.
All right, Nucleberry. Here we go. All right. Well, we're here to answer your questions. So send them to using the links on the screen through YouTube, Facebook, Twitter, or email the Medical News Network. Let's check the COVID count now with Dr. Dana Hawkinson, Medical Director of Infection Prevention Control. Doc Hawk, how are we doing today?
Hey, yeah, Steve, we have 20 this week, 20 active patients. We had 14 last week, 22 the week before, so we were going down. Certainly happy about that, but this week it's kind of back up a little bit. But hopefully it doesn't get too much above this number for hospitalizations.
I'm impressed. I can't tell you how many patients I have in my clinic that have been positive for COVID. I bet you're seeing the same thing.
Yeah.
I think still widespread community transmission, and yet hospitalization numbers haven't really jumped.
Yeah, that's absolutely right. And what we looked at from January to August of 2023 found that the vast majority of patients were 60 and over, and even of those, over 50% were 75 and over. So again, this has really become a disease of those most at risk. So elderly, immune compromised, comorbid conditions, and that's why it is so vitally important to have a plan. Number one, get that updated vaccine. And I'm sure you've been asked this recently too, Steve. If you've had COVID recently, When do you get your vaccine? We're recommending at about 3 months after that acute infection. So if you do have symptoms, test early, talk with your medical provider. If you can get on Paxlovid, get on Paxlovid. If not, hopefully you can get on Molnupiravir. Those are 2 oral antiviral medicines. Those both help reduce your risk of going to the hospital.
So, Hawk, I've heard someone on the internet or something saw some things that we're accumulating spike proteins from all these vaccinations. I'm not so sure that's true. Help us understand that.
Yeah, it's probably just somebody's opinion and thoughts. There's no evidence of accumulating spike proteins. Again, in these mRNA vaccines, you are creating that spike protein that will then get degraded, but you will develop that antibody and that immune response to that spike protein. Again, just as we've said, number one, you've gotten vaccines for all your life, hopefully, because that is the right thing to do. That will keep you well from the disease process if you get any of these vaccine preventable diseases. But also, your body is constantly being inundated with the environment and pathogens from the environment. So you are constantly seeing things that your body is reacting to. I don't think there's any evidence of accumulating spike proteins. I don't know what that would mean or what the adverse effects of that would be either.
Sounds a little different to me. I'm not sure about that one either.
Yeah, I mean, really since the beginning of the age of humans, even before that, your body has a way of removing those foreign particles, those foreign antigens, breaking them down. This is nothing different. This is just giving you a little bit more in a very specified manner through the vaccine to develop that immune response. And again, it's shown to be and proven to be very safe and effective.
Okay, so Hawk, let's be honest here. Yeah. I've not had my follow-up COVID monovalent vaccination yet because they weren't available to the health system. We just got them in. I understand next week there may be an unveiling once again right on this program. Is that what you understand too?
Yeah, I hope so. I was ready for it this week, but certainly next week, and I will probably be getting my flu vaccine at the same time, so we'll have dual administration. I may have had my influenza last week,
but I want to tell you, I'm really working my biceps. I'm using my resistance band, got the bell curls out.
Yeah.
I was pumping some 3-pound weights today. I'm going to be ready for you next week.
I'm going to go to the gym next week as well. But I think more to your point, that initial comment, the vaccines haven't been available. I think that is very frustrating. I know 2 weeks ago, I had made an appointment for my children to receive both influenza vaccination and the updated monovalent vaccine for COVID. Ended up getting to this commercial pharmacy, and they informed me that the actual corporate had canceled everybody's visits because either there weren't enough workers or they didn't have the supply. Certainly an hour later, I got an email notifying me of my canceled service. But that is very frustrating. I think out in the community overall, there is a lack of the supply of the vaccine going around, in addition to those other systems issues as well.
All right. Well, I look forward to getting mine next week.
Yeah,
so
for sure.
We know many of you have questions. Let's head to Studio B with Alexis Del Cid.
Good morning, doctors. We have an email right off the bat for Dr. Hawkinson. Natalie wants to know about the side effects of the new COVID vaccine. What can we expect to feel, and how could the side effects compare to past COVID shots?
I think it's really about the same, and it is heterogeneous. It is variable. So some people with their first vaccine dose of the COVID vaccine ever, they had certainly symptoms, systemic symptoms like fevers, chills, sweats for a day or two after. Sometimes they had the local site reactions with pain and discomfort, but then they didn't have anything with the second one, or they had it again with the third. So I think it is variable, but as far as what will people experience, it's really going to be you're going to be at risk of those same types of effects with this new one as with the other ones. But again, people have had variable responses, had problems with the first one, nothing with the second one, or nothing with the first one at all and problems with the second one. Again, that does not in any way determine or say anything about your immune response to that vaccine.
Yen Liang has a question. He's one of our loyal Facebook viewers about breast reconstruction. Yen would like to know, will a previous breast reconstruction surgery on one side affect the interpretation of breast imaging or an ultrasound on the other side in the future?
Great question. Dr. Holding.
So asking if breast reconstruction will affect imaging on the other
on the opposite side. Yes, ma'am.
If they've had reconstruction on that side or no?
No.
I would say, I mean, it's going to be this, if you have a normal breast without reconstruction, it's not going to change what you normally do for your imaging and your surveillance of the other side.
Now let's talk about what happens if you've had a mastectomy and had reconstruction. Will that affect the breast imaging?
Most of the time, patients don't need breast imaging if they've had a mastectomy. The only time I've seen it is if they feel something that is concerning to them or an oncologist. So, but it's usually they don't do breast imaging.
And I think, and just to say to our audience, that's because the tissue that causes breast cancer is removed during the mastectomy, so it's not there anymore.
Correct.
We have a question from Jeremy Yenser. He's another one of our loyal Facebook viewers. Jeremy would like to know how you help guide someone through the emotions, just the sheer emotions of going through a mastectomy and reconstruction. He writes, I imagine this would be a very challenging experience to navigate.
It is definitely. It's very overwhelming for patients. And when they come and see me, I kind of give them that control back, because I'm not saying, okay, now we have to do these treatments, this, space this amount of time apart, and then we have to have surgery or radiation, whatever the case may be. I kind of put the control back in their hands, and I try to focus them, one step at a time. That really helps with them. And then I just listen to them, because, it's a challenging process. It's very hard. I can't even imagine I see it all the time, but I can't even imagine what that feels like. So I just listen, give a lot of hugs.
Man, hugs are awesome. Okay. What did you think? Tell us a little bit about your emotions.
Yeah, there's a lot of emotions. When you initially meet with your team, and when I initially met with Dr. Holding, it was just learning about what was going to happen, but there was so much on my plate already that that your emotions are heightened because you have cancer. So it shifts when you move into the reconstructive. It is much less about just getting through it and about working with her, trusting her, and making decisions that are right, and having that control back, and being able to see the light at the end of the tunnel is the biggest thing.
You mentioned that a couple of times. You were a pretty goal-driven person. As long as you could have something to look forward to and say, I've got a goal, I've got a goal, I've got a goal.
Yes.
That made things a little better.
The unknown is the most terrible place to sit in. When you don't know what the plan is, or you don't know what's going to happen, that is terrifying. So.
And just say one more thing. When I walked in this morning, I met your cheering section. It had to help to have those daughters of yours be your cheerleaders when you were going through this.
It was tough. I mean, one was turning 14 and turning 16. So, we're in those years, the teen years, and they're my entire world. So my biggest goal was just to be as strong as I could for them and let them know that I was okay. And they were every step of the way my biggest cheerleaders and right by my side. And I'm so thankful for them, for sure.
That's awesome. Alexis.
Jerry has a question for you, Wendy. Jerry wants to know if you've noticed any change when it comes to the feeling or sensation in your breasts after your reconstruction.
Most definitely. There is very little feeling, actually. The area of my breasts now are pretty numb. Each year that goes by, it surprises me how much more feeling I do get back, but in general, in the areas where there is, the fat has been grafted, where I have the shape, there's really isn't any feeling. So that's okay.
But you're noticing it comes back?
I have noticed when I finished with treatment and had my mastectomy, most of my left side was numb, down my arm. And so over the course of the years, I have all that feeling back, but I have also noticed that in my upper chest area, I have more tingling and continue to get more feeling. So who knows?
Dr. Holding, talk to us a little bit. That's because, as I understand it, when you do a mastectomy, you sever some nerves.
Yeah, I mean, the nerve supply to the skin oftentimes comes up from the chest wall through the breast tissue. And so when the breast oncologic surgeon takes the breast, they take the nerves that supply that. And it's a very long, slow process for nerves to grow back. There are patients who get sensation back. It's protective sensation, meaning, you know, touch, pressure, it's hot, cold sometimes. But for the most part, you know, a lot of people still are numb, which is a risk. But again, as time goes by, I found that more and more patients, even without trying to hook up nerves or anything, tend to have at least some sensation come back.
All right.
I have another question, if we have time, from
One more,
another
you
viewer
betcha.
again. Are there newer treatment options for triple-negative breast cancer in the U.S.?
Oh my gosh, that's not in the, Dr. Holding, that's got to be inside your your bandwidth, not mine.
Nope. That'd be more the breast surgical oncologist and the oncologist.
We will get that question to the right doctors, and then we will get an answer to Yen Liang.
Yeah, exactly. All right, this has been a great discussion. First of all, I am very grateful for our guests here. I'm very grateful for Dr. Holding. And Dr. Holding, by the way, if you need an infectious disease physician, I do know one who may be here in the studio that can help you. But if you don't and you just make a speedy recovery, we're very grateful for you being here today. And Wendy,
Thank you.
I am so grateful that you're here today. Your testimony to people, that's got to help everybody. So thank you for being here. And I'm always grateful for Doc Hawk being here. Let's get some final thoughts. Dr. Holding.
Just remember, there are different options and everyone's journey is unique. This is not vain. You know, as I've said before, part of your body has been traumatically amputated, and it's not vain to want to feel whole again.
Yeah, that is really, I think, great advice, and people should warm that and take that to their heart. Wendy.
When you learn that you have a diagnosis of cancer, it can be incredibly overwhelming and scary. And from the minute that I got the folder that had my team in it with KU, I knew I was going to be okay. And every step of the way through KU, every nurse I've had, every physician that I've met with has been incredible. I feel like they know who I am and remember me. Through the whole entire treatment, I had that feeling and never felt like I was in a, you know, generic hospital. Every step of the way, KU was there, and I can't thank them enough.
Yeah,
I'm very grateful.
Thank you for those thoughts. That was very kind. Dr. Hawk.
Yeah, I'm just great show today, and thank you to our guests. And Dr. Holding, I hope you get better soon. It's always great working with her and her teams. And just want to remind people, you know, if you can find the vaccines out there, please get vaccinated, especially against these seasonal respiratory viruses, influenza, RSV, and COVID-19. It will help reduce the severity of disease and reduce your chance of going to the hospital.
You know, here's what I know. I don't have as much hair as I used to. The hair I have is a little whiter or grayer and rapidly receding, I'm afraid. But I've been in medicine for a very long time. And one of the joy in medicine is seeing what's changed over the years. I remember when breast cancer diagnosis was a terrible diagnosis, and so many patients didn't survive. And today it's a whole new ballgame. And I think we're all grateful to the terrific care of the team down in the cancer program, whether it's the nursing staff, the front desk folks, the medical oncologists, the surgical oncologists, the plastics, everyone who works together to bring the science that has been developed over the last 30 years or 40 years or whatever time frame to the bedside to improve a patient's life. That's the impact of science changing lives. And having faith in that science gives you the ability to get through the hard times so you can see the other side. And Wendy, you've been a great testament to that. So thanks to everyone. Thanks to all our guests. Thanks to our audience. Remember, faith, hope, and science, you can get to that other side.
When a rare blood disorder caused his heart to fail, he needed help that only a few places across the country offered. I'm Alexis Del Cid. On the next All Things Heart, how this beloved husband, father, and grandfather credits the medical team here with saving his life. Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.